Good afternoon, everyone. My name's Sandra Martin. I'm a senior planner and longtime health agent with Berkshire Regional Planning Commission's Public Health Program. Today, I'm joined by my colleagues, Lydia Schulman, who is the coordinator of the BRPC Training Hub, and Manasia Caesar, who's one of our lead trainers in the Training Hub. Today's training is mass sheltering and mass care, and how that intersects with boards of health and the codes that boards of health enforce, such as housing, food, wastewater, waste, nuisances, etc. And we're going to begin with an overview of what sheltering is, what boards of health do, and then how to manage a shelter. Just remember that this is our best efforts at understanding the public health role in mass care and sheltering. And sometimes the interpretation of the regulations and best practices are basically ours and not necessarily anybody else's. So we welcome your questions in the chat. You can turn your video on if you want to ask a question, but basically anytime you want to ask something or put it in the chat or raise your hand. We're going to define mass sheltering. We're going to talk about the relevant housing code sections. We will briefly talk about migrant and family shelters because they're topical and happening everywhere now. We're going to talk about volunteering and incident command system, and we're going to try to understand how to actually run a mass care shelter. This training does not meet any code requirements or training requirements, and so they are for your information only. There are lots of different kinds of overnight shelters. Emergency shelters. Some are overnight and some are not. They're temporary they're supposed to be temporary in nature. And the ones we know traditionally are congregate mass care shelters run by the emergency management directors, the towns or the state, to provide a safe location in emergencies such as an evacuation. There are also warming and cooling and personal care sites where they usually are for a short number of hours during the day. They provide places to cool down or warm up, charge your cell phones, get snacks, beverages, use the internet, whatever, and they are often run by the emergency management director or the board of health in a town. Reception centers and reunification centers are open short term to triage, receive, and process could be victims or families, evacuees, whatever the need is. Basically, it's a sorting center that the focus is trying to move people on to the next place they need to go. Other types of shelters include homeless shelters, which are defined in the code, and family migrant shelters, temporary accommodations for family groups, non-congregate shelters, which were used quite often during COVID in hotels and are now being used for the migrant shelters as well. They're not in not in everybody in a gymnasium someplace, but they're in hotels. Alternative care sites were used briefly in locations during COVID to treat COVID illnesses when there was an outbreak and the hospitals were overwhelmed or they wanted to isolate the sick. The housing code has these definitions. A temporary emergency shelter means any building in a church, any used for sheltering in a church. It's very specific that it's in a church. Homeless shelters are defined as a residence operated by a service agency to provide temporary overnight sleeping accommodations. There are places exempt from the housing code. And the ones we're interested in today are number 2, used exclusively as a temporary overnight shelter. Mind you, they do not define a temporary overnight shelter in the code. A a place operated by, or they say in the code, owned by the agency of the Commonwealth, but that's been further defined by people from Department of Public Health as to mean if they are supported by the state or the state supplies funding for them, they're considered to be state supported and under the code and not subject to the housing code. Then there's also places that are licensed and under other parts of other codes like hospitals, nursing homes, and so forth. And then, of course, any federal agency organization is also exempt from the housing code. Likely, most of these are not exempt from the disease reporting and surveillance codes. There are exemptions in the housing code for homeless shelters, and mostly around spacing, size. So you don't have to have the same bathroom ratios or the bathroom door doesn't have to lock. There's minimum square footage that you don't have to meet. Basically, as long as you keep the heads of the people in the beds 6 feet apart, you meet the spacing requirement, and et cetera, et cetera. So basically, when you have a homeless shelter, these things are exempt from the housing code. The Board of Health and shelters. So remember that state-sponsored shelters are likely exempt from Board of Health enforcement actions. And church emergency shelters are probably exempt from the housing code. They still must be safe and sanitary under the Mass General Law nuisance codes, and they're probably not exempt from the food or the Title V codes, unless they're state supported or managed, in which case they probably are exempt. Homeless shelters likely are subject to most of the housing code for pests, waste, but not sizes. And they're probably subject to the food code as a temporary nonprofit. Boards of health, even though sheltering mass care is a duty of the town and of the emergency management director, boards of health are often tasked with running and supporting local shelters. So who is responsible or owns a shelter? It depends on who sponsors the shelter as well as where it is located on who actually is responsible for the shelter. It's likely responsibility of the town where the physical location is, but it might not be entirely that town's responsibility if there is a written mutual aid agreement to otherwise. If the Red Cross supports the shelter, manages, staffs, and pays for it, they're in charge. If the town emergency management director manages and pays for the shelter, then usually it's just for their residents, but not always. If the Department of Public Health and the Office of Housing and Livable Communities supports the migrant shelters, then they're state-sponsored. So the Massachusetts is one of the only states in the United States that has a right to shelter for families law. New York City has a similar law, but we're the only state to actually have the requirement that we shelter families. It does not apply to homeless individuals, only to families. Migrant shelters just need more of everything. They are usually open longer. They require more language skills. They require more wayfinding and pictorial signs because the languages, there might be a diverse number of languages in a migrant shelter. They require cultural awareness. They require you maybe to basically teach them how to use facilities that they're not familiar with and protocols that we all take for granted. They might need more medical support. They might need more emotional or mental health. They will definitely need more legal support. And so basically support services of all kinds, and it may be a long-term situation. So migrant shelters just need more of everything. So if you're planning for a migrant shelter, you're going to need a team. And it will vary by county. In Berkshire County on the left are organizations that I know are involved in migrants and immigrants. And on the right are state organizations and agencies that I am aware are involved in the migrant shelters. This list is not exhaustive, and it might be different in your community. Who goes to shelters? Only people who have no place else to go. If you've ever been in a shelter, an active shelter, they're safe, but they're not comfortable. Nobody chooses to go to a shelter if they have other options, unless it's just for a very short term while they find another place to go. Sometimes people have no choice because there's a mass evacuation and everybody's dropped at the shelter. They may not have their credit cards. They may not have an ID, so they can't go to a hotel. Their friends are not available. They might be low income and can't afford anything else. People in shelters tend to be older, sicker, living with more disabilities and needing more care and support than the general population. And they may just be people who don't have a network of family and friends in that area, or they don't speak enough English to find other options. But people who go to shelters are ones who have no other choice in general. It takes a community to run a shelter. So think of all of your partners in your community if you know you're going to have to operate a shelter, you're going to have to make best friends with the building inspectors, the fire inspectors, the police, the emergency medical services, volunteers, the the whole list of people that you want to be able to call on if you have to open a mass care shelter. In most emergencies are run using the incident command system. And so you should be familiar with at least the terminology and the concept of incident command. And since I'm just going to do a really brief overview of what is incident command system, it's the incident commander or the group of incident commanders called a unified command are in charge of the emergency. And the concept is one person supervises no more than 7 people. It's called the span of control. And it ensures that nobody is overwhelmed by the number of people they supervise. And the main thing is everyone knows who they report to and who reports to them. It's based on military and fire services protocols that work during emergencies. Basically, you just need to know under ICS, Incident Command System, who you report to and who reports to you. If you got that basic concept, you've got incident command. Remember safety first. If you're in doubt, always call for help. If you are at an emergency response, sign in and out every time so that they know who's there and who's not. Document everything. If it's not documented, it didn't happen. Don't talk to the media unless you've been authorized to do so. Come to the emergency personally prepared and responsible. Stay in your lane and focus on your job. You now know the basics of incident command system. Most emergencies don't come with warnings. So think of mass care shelters as small villages. Shelter managers are like mayors of the village, and the incident commander is the governor. So emergencies that often require mass sheltering, the normal ones, ice storms, flooding, power outages. Now heat emergencies are emerging, cold, fires, tornadoes, hurricanes, and now our sudden influx of refugees. All of these might require a mass sheltering operation. FEMA has a really excellent field guide, pocket, it's not quite pocket, it's a little bigger than pocket, but field guide to use in mass, reminding you what the basic elements are of mass sheltering. There are also others that are available, but there are 3 basic essentials for every shelter. You've got to have a safe facility, you got to have staffing, and you've got to have supplies. So shelter operations, you first identify and set up the shelter. So use a shelter facility checklist. You provide life-sustaining and essential services in a safe, sanitary, and secure environment. And remember, there's a checklist for this too. Keep in mind access and functional needs when you're setting up your shelter or choosing your shelter location. You want to be able to provide basic first aid and connect residents with medical care as needed. You want to help shelter residents plan and transition to their new normal. These shelters are not meant to operate longer than they have to. And you want to plan for closing the shelter. So these are the 5 basic operations that you focus on when you're thinking about your shelter operation. Western Region Homeland Security Advisory Council has a checklist for everything. These links will be in the end of the PowerPoint and everybody will get a copy of them. But if you want a checklist for a shelter, the WRSAC has shelter kit has it. They're in the shelter WRSAC's kit, their facility checklist. So the location, remember the location needs to be safe. It can't be someplace that's flooding during a flood emergency or mudslides or fire during those emergencies. It should be convenient and accessible if possible. Down a long, dark road that's hard to get in and out of is not a good shelter location, unless you have no other choice. Must have all the basics, like water, food, toilets, sewage, power, fire extinguishers, smoke alarms. You have to have parking areas, pet areas, heating, ventilation, and air conditioning, good lining. So you need all these things to be considered in your shelter if you have time. You need enough space for the toilets, the dormitory beds, food, medical, pets. All these things go into planning your shelter based on how many people you expect to be there and how long you expect them to be there. There's staffing checklists. So the minimum staffing for a well-run shelter, a safe, well-run shelter, is 4 to 6 people per maximum of 12-hour shifts. You want the 4 people you want to have at every shelter is the shelter manager, the mayor, the security registration. You want to make sure that people are secure and safe in your shelter, medical and mental health support, and food, dormitory, and sanitation. So if you have those 3 unit leaders, that is the minimum for a shelter. 6 is better. It's all based on who's available, who's trained, who's credentialed, on their cultural competence. If you need extra language or extra ethnicity understanding, needed skills and resources. So basically, you're looking for certain aspects, certain ideas in your volunteers, but you'll take anybody you can take if you don't have enough staff. You can also ask shelter residents to help out with staffing. They should not take a leadership role, though, if you can avoid it, but to help out is a good thing. There's a supplies checklist, medical supplies. You want to have first aid kits with Narcan in it. You can say no drugs all you want, but they're coming. They'll come in with people. You'll have medications that might need refrigeration, so they'll need secure storage. Spill kits for spills of all kinds, whether they are for personal use or for community use. You need to have kits around to help clean up spills, sharps containers, AEDs, masks, gloves, sanitizers, that whole stuff. You want to have painter's tape or some way of marking out the areas in your shelter. So before people start to arrive, if you have time, mark out the aisles and the areas for the dormitory, the food, etc. Because otherwise you'll have a jumbled mess you can't get through. You want your cots and cribs and tables, chairs, some of them with arms because older, frail people can't get in and out of chairs without arms. Forms, pencils, flashlights. List is long. And when there's a checklist for it. So just keep in mind that you're going to have to be gathering supplies, and hopefully your emergency management director and your emergency operations center will get the supplies you need. Staffing. So there are all types of shelter staffing needed. You can get your staff from, maybe they're municipal employees. Maybe the Red Cross will help out, although generally Red Cross volunteers serve mostly in Red Cross shelters. You would like, ideally, to have all trained and credentialed volunteers. So the Medical Reserve Corps, the community emergency response teams, the fire auxiliary, police, state volunteer system, whatever, having them pre-screened to ensure that they pass the criminal and sexual surveys, so that you know that your staff will not cause a problem or you're hopeful that your staff will be ready to serve without having core inventory checks done. Spontaneous unaffiliated volunteers are the least usable volunteers because you don't know who they are or what their training is. One of the job aids that we will provide you is a volunteer pocket guide. It's kind of a guide to how you take these unaffiliated volunteers and you work them into your system. And FEMA and the National Guard also have been providing support at the migrant shelters and others, but most shelter staff are local volunteers. Before you go to volunteer, or before you ask people to volunteer, you ask them are you prepared? Is your family prepared? Do you have a personal emergency plan? If you're worried about your family, it's very hard to go out and volunteer someplace else. Are you willing to do whatever needs to be done? Are you aware of the potential risks? Can you safely get to the shelter? Sometimes it's not possible. I've known people who during a sheltering operation had to have a snowmobile come pick them up, or a truck or something like that to get through the snow or ice or the flooding. And also, what are your personal limitations? No, you have to know if you have to eat every 2 hours, or you need to take your medicine, or and in 6 hours you're really done. So you need to know your personal limitations, and then you can volunteer. Emergencies are demanding. It's normal to feel anxious. So take care of yourself, know your limits. If you have trouble dealing with the effects of the incident, ask for help. Don't wait. Be cautious and compassionate. Practice active listening. I would just say that during emergencies, the temptation is great to resort to substances to take the edge off, or to help you sleep, or whatever. These are not effective ways of dealing with anxiety or with feelings, the effects of an incident. Try getting help instead. And always, if you're in doubt of your personal safety, call 911. You tell your volunteers what to bring and what not to bring. So bring your snacks and your hand sanitizer and your mask, and make sure your clothing is appropriate. You have a government issued photo ID, and you have a backpack, a belly pack to carry it all in, and you come with a good attitude. Don't bring your children under 16, your pets, your valuables, weapons, drugs, alcohol, attitude, personal agenda, bias, or prejudices. Those don't belong in any emergency response, and definitely not at a shelter. Okay. I see from the chat that the MRCs are actually assisting with translations in shelters today as we speak, and that's great. So job action sheets, there should be a job action sheet for every position. If you are using the job action sheets from the Homeland Security Council shelter kit, there's a job action sheet for everything. If there isn't one available, you will need to have more explanation about what your job is and who your supervisor is. The job action sheet should have all that information on there. And nothing should be beneath a volunteer. We've had to sometimes ask doctors, who we didn't need a doctor right now. What we needed was somebody to sweep the floor or put the food out. So everything is important in a shelter operation, and nothing should be beneath a volunteer. And if you are not sure about the tasks that you're being assigned at a shelter, ask. And always think safety first. First, you protect yourself, then you protect others, then you control the problem, and then you save property and the environment. So the minimum requirements for sheltering are the safe location, protection from the weather, safe air, food, and water. Every shelter should meet these minimum requirements if possible. Shelter setup depends on the situation. So what's the emergency? Is it hot, cold, windy, rainy? Is a hurricane coming? Is it flooding? Who are you serving? How many? The Red Cross estimates that maybe 10% of an evacuated population will need sheltering. How long do you expect it to be open? Depends again on the emergency. What kind of resources, including volunteers, do you have available? If you don't have very many volunteers or many resources available, your operation is going to be a lot less comfortable and safe. And don't forget, you have to always plan for demobilizing the shelter. Planning for demobilization happens the day you open. So you can use the WRSAC facility initial survey form to go through and check out the location, the ADA, which is required. ADA accessibility is required for longer term sheltering. Is there parking? Can buses get in and out? You want to make sure that the smoke alarms and fire extinguishers all work, and so forth. So use that shelter assessment checklist. This is what it looks like. And it basically walks you through everything to think about. So the criteria for selecting a shelter, not in the floodplain, remember. Don't cross a river to get there. Be near transportation. Near a population center is ideal. It's easier to get people in there if you're not out in the middle of nowhere. You need a space for pets. It's now the law that you have to have a pet shelter in the same place you have people shelters, because we've found people won't leave their homes without their pets. So they're coming anyway. So you got to plan for them. And because of allergies and cleanliness and stuff, it's better if the pets are in a separate location or at least a separate room. Near a hospital would be great. And of course, you need permission from the owner of the building. You need to think about the security. Is there a generator? Is there fuel for the generator? Do they have HVAC with the proper air filtration? Do they have enough bathrooms? Are there showers? Is there a laundry facility available? Do they have secure storage, refrigeration? Do they have all the required areas like registration, dormitory, food, childcare, a quiet area? Very important these days. Some individuals living with disabilities require quiet, and we all like quiet when we get older. Consider shelter supplies. Western Regional Homeland Security Advisory Council has pre-positioned shelter trailers throughout Western Massachusetts. Most of them have like 100 cots. Some of them are bariatric cots, which means they're higher, wider, and heavier for individuals who are overweight or can't get up from a low cot. They can't stand up from one. So these bariatric cots are in the trailers, as well as blankets, pillows, floor mats, linens, towels, things like wheelchairs, walkers, canes, etc. The disaster animal response team trailers at the Sheriff's Department as well they have kennels, pet supplies, and a mobile trailer that can come to your shelter. You have to probably add the sanitary supplies and things that you can pick up at the local grocery store. MEMA also has access to shelter supplies, of certain shelter supplies if you can't find them locally. Estimates for shelter costs in 2010 were around $25 per person per day, plus donations. This number is probably doubled now because of inflation and because we know everything costs more these days. Municipal shelter expenses. With a disaster emergency declaration, a town can exceed its budget. A Board of Health cannot exceed its budget, but a town can with a disaster declaration. The chief elected official coordinates with the local emergency management director to make this declaration, and the finance section chief works with other boards to track the costs and expenses. So I'm going to briefly go through a shelter activation. I'm going to assume that you need a mass care shelter, that it's already been determined by the incident commander. You all have an operations section chief who has appointed you as the shelter manager. There is a facility already. You don't have to go out looking for one. And the point of contact for the facility knows you're coming, so you don't have to arrange that. And there's an emergency operations center, an EOC, that's going to support you, so you don't have to go finding the supplies. So I've taken away a lot of the things that probably in reality you'd have to manage, so we can talk about the actual management of the shelter. So somebody calls you up and says, you're assigned to be the shelter manager. You've got some questions you've got to ask, like, where is it? Where do the pets go? Who's the facility point of contact? Where's the emergency operations center, and how do I contact them? How do I get there? How many evacuees are you expecting? When will they be arriving? How many days is the shelter expected to operate? How many volunteers do I have? When are they coming? Who's supplying this, all the things I need, like food and water and so forth? So a local shelter incident command system chart where one person does everything is technically feasible. It's not a good idea, but you could, a shelter manager with 1 or 2 people, I suppose, could do everything. It's still not a good idea because it's not safe to have one person alone in a shelter. Never operate with less than 2. The second person could be a security person. Better is a minimum staffing with the 6 people that we talked about in the beginning, with a food unit leader, a dormitory unit leader, a medical unit, and a pets team. So think about the minimum staffing as 6, but you could get by theoretically with less. People double up. Incident command system chart for the Western Region Homeland Security Advisory Council. Regional shelters, you can see, is very complex. And yes, there are job action sheets for every one of these positions. So setting up the shelter, the first thing you do when you arrive, tape out those aisles 3 to 4 foot wide. So basically, so that you also label the triage reception center where people are coming in and signing in or being triaged. You want your food and beverage center away from the dormitory if possible, please. The dormitory and childcare should be off to the side, but close to the toilets. You want a medical area and a secure storage area, and you need that place for pets. Service animals, you have to accommodate in the shelter. So keep that in mind. You might want a corner for individuals who arrive with a service animal. They need to be trained service animals. They need to have they can't just be a pet that somebody's calling a service animal. And you don't have to take exotic animals either. If somebody arrives with a service animal like a horse or something like that, you're not obligated to keep them in the shelter. Print the form, so you've marked out the areas in the facility. And now you want to print the forms and the job action sheets. You want to sign in your staff. Everyone who walks in that door signs in, and when they walk out, they sign out again, because you need to know who's in your shelter at all times. You give your staff your just-in-time training. You hand out your job action sheets, badges, vests, some kind of identifier to show that they are staff. You get your supplies organized. You get your secure storage area set up, and you get ready to receive your shelter residents. Now, the truth is sometimes the shelter residents beat you to the shelter, and you just have to make do because they've been evacuated, and the fire chief, when he's evacuating them, decided he had to put them someplace so we could go back and get more people, and so they're already there when you get there. You do the best you can, but ideally you should be there first. You print these job action sheets if you don't print anything else. The shelter manager, the registration team leader, the food team leader, dormitory, and the medical, so that those job action sheets will have lists of everything that happens in that area. So the food team leader will know what all the jobs are in the food area, and same for dormitory, so that if they have to, you just keep printing off the same ones, copying them, and circling what the task or assignment is for your volunteers. And as you have time, go back and make sure you keep assessing the safety of your shelter to make sure that the staff and the evacuees, residents are safe, because that's your number one priority, is safety. You want to post accessible, clear signage. We now know that older adults and people living with the disabilities need very clear, unambiguous, easy to read, eye-level signs for everything. Don't put things above a doorway, because people don't look up. When they get older, they don't look up, they're looking down. Post the shelter rules as soon as you can so everybody's on the same page. There's a list in the WRSAC shelter kit of suggested rules, but you can make up your own. But it's hard to think on the fly when you're so busy. So I'd start with the ones in the shelter toolkit, and then you can always cross them out if you don't want them. You want to think about the access and functional needs and ADA accommodations, which are required in long-term shelters, overnight shelters. It's the law now. You have to accommodate. You want to get your health and safety inspections from the fire, building, and public health. And you set up your charging stations now and internet if you can right away, because we now know everybody's coming with their cell phone. Everybody's coming and wanting to get on the internet. So you just need to get ready to do that. And it will make your life easier, because we used to have to do the telephones there and help people make telephone calls. Now everybody will do their own. You just have to provide them with the service to do it. The longer a shelter operates, the more supplies and services you need. People can live in dirty clothes for a little while, but eventually they're going to need laundry. And most shelters do not come with laundry services. Many of the small shelters and small towns don't have showers and towels either. And you need, people are going to need to get doctor's appointments and get medicine, and food preferences and diet restrictions. You have to start considering those. The meals get more complex. You can't just have a bucket of fried chicken brought in or pizza and say you provided food, because eventually there are people who can't eat that or won't eat it. And you need to think about school and work. If they're there for weeks and people still have to go to work and still have to go to school, as happened in Springfield during the tornadoes, if people were there long enough, they had to get back to work. They had to go to school. So you had to start thinking about daily transportation and legal and insurance appointments. So the longer the shelter operates, the more things you got to do. So there's a standard operating guide for shelter operation. Just don't, basics of sign everybody in and out, and brief the staff before each shift, and go over the rules and regulations, and document everything. Any problem, any issue, you document. Nobody wants to have to go to court over any of this, but if you've written it down at the time it happens, the court will give deference to what you've written down. If you try to remember it, it's more he said, she said. You want to teach people to, if you see something, say something. So basically, this is standard operating guide has lots of tips like this that will be useful when you have time to read it. Triage everybody coming into the shelter for health and safety issues. You want to know if they're sick. You want to know if they have medical needs. You need to know right away if they are, are diabetic and they haven't had their medicine for a while, or are they on blood thinners or whatever it is. You need to know right away so you can make sure that they get what they need. And if they have dietary restrictions or medical, religious, you need to know about their pets, their service animals. If they have regulated substances with them, they have to have a script for it. So basically, otherwise, you don't want any of those in your shelter. Post your rules. Ask for volunteers to help in the shelter from the residents if you need them. There are 30 plus job action sheets in the shelter kit, 70 forms and templates, the standard operating guide checklist, and there's actually an online training as well. If you have time to do it and have access to internet, it will walk you through each of the positions, and all that's on the wersac.org website. Print these forms, the shelter check-in and out form, the daily action log. A client case management form is really advantageous because it walks you through all the things to ask people to consider. You should also print the rules and regulations and post them, hand them out, make sure everybody's aware of them. And an incident report form is where you write down what happened, who did it, what happened, and as many details as you can. And you want to do it right after it happens. Don't wait for the next week, or even the next day is pushing it. So this is an example of the sign in and out sheet. And there's a log for every event. Put it down as soon as it happens. This is the case management form. It has lots of things for you to consider. And so it's a good reminder of things to ask people. This is your personnel sign-in sheet, so that you can keep track of everybody here. It also helps if there is ever any federal reimbursements. The volunteer time counts if you've logged it. If you haven't logged it, you won't get points for it. But if you have volunteers, you properly documented their hours and services, you can use that as your required match for federal and sometimes state reimbursements. Ensure your shelter is safe. It's safe and secure for both the staff and the residents. It's your primary responsibility. Public health, you need to prevent hazard and illness from spreading through a community. And this is a small community, but it's yours. Considering access and functional needs support services is now a requirement in many ways with ADA requirements. Health and safety inspections. You as a Board of Health should go out and inspect the shelters to help maintain minimum standards for the facility, the food, the waste, the water. The disease surveillance is definitely a key issue. Norovirus will roar through a shelter, as will some other diseases, so you want to keep on top of that. The rules, for example, in a shelter that we suggest strongly are no regulated substances without a prescription. So that means no alcohol, tobacco. Tobacco is actually a regulated substance in Massachusetts. Marijuana, opioids, those are all regulated. And unless you have a prescription, don't bring them in. I wouldn't allow smoking of any kind in a shelter. If they have it, I don't care if they have a script for it or not. I would not allow it. No weapons, no smoking anywhere, no pets, service animals only. The pets go to the pet shelter. No valuables. Tell people you're not responsible for their values. If they insist on bringing them into the shelter with them, you are not responsible. So help out. This is a yes. This is a part of your rules and regulations. Tell people to help out, help clean the bathrooms, help serve the food, help take care of the kids, help your neighbors, respect everybody's privacy. What are the quiet hours? You'll have to decide what works for you, but 10 p.m. to 6 a.m. is probably as good as you're going to get because people have to get up in the morning and go to work and school and stuff like that. So probably 10 to 6 is as good as you're going to do. Maybe you can stretch it to 7. Get people to report issues instead of just complaining and mumbling and creating unrest in your shelter. So here's an example of the shelter regulations that are ready for you to print. The shelter areas. So basically you want to figure a minimum of 20 square feet per person that you expect to be in the shelter. 40 is better. And if you want to meet the ADA requirements, 40 is almost standard now. You want to figure out drinking water of 1.5 gallons per person per day. The other water for flushing toilets and stuff, 4 to 5 gallons per person per day. A toilet for every 20 people, a shower for every 25. You're going to have to either have a male and female or a system to take turns. Solid waste, lots of 30-gallon containers, 1 for every 10 people. The aisles on minimum of 36-inch wide. Probably 4 feet is better in the handicapped area. And remember, people are going to come with their stuff and they're going to have it stacked everywhere. That's why you want to make those aisles very clear that nobody can put anything in the aisles, because otherwise soon people have their stuff stacked everywhere. Those heavier cots we talked about, the taller cots for the disabled, reserve those cots because everybody will want one. So reserve those cots for the people who really need them. Wheelchairs and walkers, you're going to need them. You're going to need backup lighting. You're going to need a locked area for your supplies and medications. Shifts should be no longer than 12 hours, 6 to 8 hours is better. Minimum 4 to 6 staff at all times, never less than 2 people for safety. And you want to have a good cell or radio service if you're there with only 2 of you. Safety first. Remember, safety first. Respect people's privacy and dignity. Manage expectations for people. Remind everyone that you're volunteers doing the best you can with what you have. That this is not a hotel. This is not something that they just have to manage their expectations for what you can provide. And remember, remind them that safety is first. You expect civil discourse and politeness from everybody, and listen actively so that you can know, so people know that they're being heard, but don't allow for civil unrest in your shelter. Plan for the pets, they're coming anyway, all shapes and sizes, but you don't have to take horses or other exotic animals. If somebody brings a snake, you do not have to take them. More shelter operation tips. Assign shelter resident leaders to keep the shelter areas clean and organized. Post and enforce the rules, the quiet hours. Know where to find the security, the Narcan, the AED, the first aid kits, the radios, the phone. Assume you have dangerous and banned substances in your shelter. Just assume that you have them and be prepared to deal with them. And work with the shelter residents to solve problems as they arise. Don't ignore them. These are lessons learned from local shelters. Most of them are small, less than 30 potential shelter residents. Probably the true capacity of the facility isn't really known. They may have backup power, but they will probably not have a real kitchen or real sleeping areas, shower facilities. They may or may not have internet, cell phone, and they may not have air conditioning either. They have limited capacity for sheltering pets indoors, which could be a real problem in the winter, but maybe you'll have to get a tent to shelter the pets. Who pays? This depends on who runs the shelter, who opens it, who runs it. Usually it's the local emergency management town that's as the responsibility of the local government. A regional shelter may have a cost sharing agreement with the host town. It depends on who pays, but generally it's the town it's in. So I'm going to review the basics of sheltering. 1 was a safe facility, 2 was security and staffing, 3 was the basic operations, and 4 is making sure you have safe food and water. So as in every emergency, you do the best with what you have. Use the facility checklist. It's an ideal, but it gives you an idea of the things that you should be looking for in a shelter. Never less than 2 people for staffing because of safety. 4 is better. Those criminal and sexual offender registry, make sure your staff is CORI'd, SORI'd, and if not, partner the spontaneous unaffiliated volunteer who you don't know who they are or where they come from with affiliated staff. Don't ever leave a volunteer who is not CORI, SORI'd alone with children or elderly. The fast registration is important. If people are coming in the door too fast, actually go through your registration, hand them a registration form and a pencil, and get them inside where it's warm or cold, cool and safe, dry, and let them fill out the forms when they have time. But get their names as they come in the building if you can. Remember, you want to sign everybody in and out, so at least get their names so you know who is there. Dormitory. Place the beds away from the food and near the toilets. Assign a cot as soon as possible, but don't put all the pillows and blankets on the cot. When you see the pictures of the shelter getting ready to open and they have the pillows and the blankets nicely folded on those cots, don't do that. What'll happen, people will come in and grab 2 pillows and 3 blankets, and pretty soon you have cots without anything. So as people come in, assign them a cot, issue the pillows and blankets, unless you've got plenty of those things, and it doesn't matter. Mark out a family area in the corner, because they'll probably pull their cots together and form a kind of their own area. Waste management, very important. Make sure you've got enough toilets and sinks. If you don't, get portable toilets. Plenty of trash barrels. You can't have too many of them. Have a cleaning and sanitation schedule. Offer hot beverages and snacks as soon as everybody arrives. Ensure that it's safe food and water to avoid illness. Know where the food is coming from. A good rule of thumb is after 4 hours, throw it out. If you have a very vulnerable population, 2 hours is about as long as you want to leave food sit out on without heat or cold. But basically, for most people, it's 4 hours and discard it. Wash your hands frequently. Give hand washing stations and sanitizing solution everywhere you can, because you don't want an illness to rip through your shelter. So I'm going to answer questions. Before I do, I want to show you that in this, there are all kinds of resources, links to all the things that I have mentioned and others, emergency phone numbers, and the communicable diseases that you have to be watching out for. But basically, these are resources, job aids that you'll get with the email for everybody who's registered today. So, questions? Any questions? I ran through, this is a quick guide to sheltering. It's an overview. It won't make you an expert, but knowing what you don't know is good, because in a shelter operation, nobody knows it all unless you've done this hundreds of times, because each shelter is different. Every emergency is different. Your volunteers are all different. And so you just have to be very flexible and do the best you can during any shelter operation. Questions, comments? Yes, the code exemptions under migrant shelters. So far, the migrant shelters have been state-sponsored. Therefore, the code requirements go away. I think most of them go away anyway. It's a gray area. I tried to get DPH to confirm, community sanitation to confirm what the role was in state-sponsored shelters, but basically nobody wanted to go there. I would say that you're still responsible, the Board of Health is still responsible for safe food and safe water and safe air in any facility, if nothing else under the general nuisance laws. But the housing code definitely does not apply to a state-owned, which I'm interpreting as state-sponsored shelter, which most of these migrant shelters up till now have been. According to the governor, come November 1st, tomorrow, they will no longer be sponsoring shelters, but they may be providing resources for local shelters. That's unclear yet. That's the housing code I'm talking about is the sanitary code, the public health sanitary code. There, I should have made clear there are all kinds of codes that impact housing. There's the building code, that's not boards of health. There's the code, there are federal codes around housing, there are other codes around housing, but basically I'm talking, when I talk about the housing code, I'm talking about the community sanitation 105 CMR 400. Any other questions? And the code violations, when the shelters are no longer managed by the state or supported by the state, and it's just a regular emergency shelter in your town, a regular migrant or a homeless or whatever the shelter is, your job is to ensure safety of the occupants. So my advice is to focus on that. And remember, there are certain things about space that don't apply, separation, sizes of rooms, locks on the bathroom doors, and so forth may not apply during a congregate care shelter, but may apply if a hotel is being used as a shelter or something like that. So this is use your best judgment and focus on this health and safety issues rather than enforcement issues, and try to work with the managers of the shelter to ensure the health and safety of the residents. Yes, there's a lot of information to digest. This is just a brief overview. The FEMA shelter trainings is 3 days long. The Red Cross shelter training is at least that long as well. And they're not necessarily talking about housing code and other codes. They're just talking about trying to operate the thing and keep it safe. We, with the boards of health, have to think a little broader about the impacts on the whole community, not just on the individuals in a shelter. And it is a lot of gray areas when I was researching the various roles and responsibilities for these shelters. Any other questions?
Go ahead, Bree. You should be able to talk. No?
Yep. Go ahead, Bree. No, you're still muted. Bree, you're still muted. I guess, Bree, you're still muted. All right, any other questions? Some of the towns have worked closely with Department of Public Health and about the migrant shelters, and they are getting them to comply with the codes, which is the way we want to go. The codes are there to create a safe environment for everybody. It just, rather than enforcement, we're looking at compliance with safety standards. And remember, in every emergency, you do the best you can with what you've got. And each town, the lead on a shelter depends on the town, the city, and nobody has the capacity to take on a shelter. It's just we don't have standing capacity to take on something this big and extra. But in an emergency, you do what you have to do. If people are being evacuated and you have to open the shelter, you do it. A little advanced planning is a good idea. Having an idea what the shelter locations are in your community, working with your emergency management director to pre-identify them and to talk about the basics of how many people could be sheltered there. Do they have the backup power? Do they have air conditioning during heat emergencies? Do they have whatever? It's a good idea to talk to your emergency management director now, get to know them. And it's not a matter of you want to. In an emergency, you just have to. And then you worry about it afterwards. But none of us are prepared to manage a shelter unless we've done a lot of pre-planning around it. Any others? Yes, remember the emergency management director is nominally in charge of sheltering in a town or city. But the practical matter is they're busy with the emergency. Whatever caused this shelter to be needed, they're busy with other things. They're the fire chief, they're the police chief, they're whatever. And so they're busy with other things. And so often they call up the Board of Health because this is a health and safety issue and it's called the Board of Health. We're all familiar with that. Anything else? So the slides are purposely dense so that you can go through it and stop and read them all during, if you need to go back as a reference. But I strongly suggest you consider downloading some of the job aids, which are shortened versions of everything on how to manage spontaneous unaffiliated volunteers. It's only a 2-pager, print it, and hand raised.
Yeah.
Sharon.
Yeah, can you hear me?
Yes.
Okay. So I'm just wondering when you were mentioning regarding like having areas for, families as well, larger areas. Now, if you have someone that comes in, you were mentioning about screening if they're ill. If you have somebody that comes in if they're ill, are you setting up a separate area for them as well?
If you've got the space, you should have an isolation room, basically.
Mm-hmm.
And it's one of the facility check boxes. If you're going through and looking at your facility, is there a space that you can set aside for basically quarantine medical until you can transport them someplace else? And that might be the time when you try to put them into a hotel or some medical, depends on what the issue is and how ill they are. But basically, you want to keep them out of your main shelter area. Find them a spot, if nothing else, in the corner away from people. But a different room would be the best. It's an issue. Yeah. And one of the tricks that we used to do during warmer weather, when you wanted cold drinks, we used to put a little bleach into the water with the ice cubes and the drinks that are getting cold in the bucket, because people are dipping their hands in to grab the things and you're trying to stop viruses, bacteria, whatever, and Clorox is cheap and easy. Mind you, it spots everybody's clothing, but
Mhm.
it might save you from an outbreak. But yes, you want to be very clever. And that's one reason why the Board of Health should be involved in this, is to help with cross-contamination in the food, to help with disease prevention and management. That's what we're supposed to do. Okay, anybody else? We are always available with questions, and if you have comments on the slides or the job aids, corrections, additions, more explanation, whatever, they are always gratefully accepted. I constantly improve things as I learn more, and better ways to tell stories about how to make this stuff workable. So any direct information or feedback you have, always appreciated. So if there are no other questions, I think we're done.
Okay. Well, thank you everybody for coming.
Thank you.
We'll get these materials out to you after.